কি কি সমস্যা হচ্ছে বলুন?
আমার রাইট হ্যান্ডে এখানটা থেকে এখানে পেন হচ্ছে, মাঝে মাঝেই বিশেষ করে সকাল রাতের দিকে আপনার এটা জাম্পিং করে জাস্ট বিদ্যুৎ চমকানোর মতো পেন হয়, এখানে হয়, এখানে হয়, এখানে হয়।
We'll analyze the X-ray of Mr. Bala. So as we can see, this is a Gonstead Chiropractic X-ray of the cervical-thoracic region. Here we can see, if you look at the lateral view, the cervical curve is, the lordosis of the cervical curve should be on the front side. It's actually gone kyphotic. So it's become kyphotic, especially at C4, 5, 6 level. There is gross degenerative changes. The most interesting part that you can see is there is no gap between the first cervical vertebra and the occiput. This is the occiput and this is the first cervical vertebra. Okay. There is usually a half and 1/4 of an inch gap between these two bones. So what does that suggest? Usually this happens when you have an occiput that has shifted anteriorly superiorly. So the occiput has shifted anteriorly superiorly on the first cervical vertebra. Once that happens, this locks the upper cervical region, and then there is a lot of abnormal biomechanical stress on the mid cervical region, and then the degenerative changes starts. The first thing that we have to look into is to bring back movement in this region. I think we'll have to first look into the C0 C1 component. C0 C1 component. The next thing that we have to looking at the AP view. This is the right side. This is the left side. I marked some vertebrae. As you can see, if you see C2, you'll see it's slightly tilted up. That usually happens if there is a disc bulge between C2 and C3 on the left side. The other thing that we have to look into is C0 C1 capsule. There is no disc between C0 and C1. There is a capsule, but that can itself get swollen and inflamed, and that can cause an upward tilt for the head on that side. So we'll first try to sort out the issues in the upper cervical spine, and then look into what other things can be done. So we'll do some motion palpation for the upper cervical spine. The first thing that we do is the side bending to the left, and then side bending to the right. You can clearly see the side bending towards the left is way more restricted than the side bending towards the right, which is what we should expect, because if you can see, the cervical upper cervical is lifted up on the left side. So probably that's because of a disc or the inflamed capsule that's not allowing the vertebra to side bend to the left. So then we have to find out the problem is between C0, between the occiput, and C1, or between C1 and C2, or C2 and C3. So all these three joints will be involved in this pattern. So first we will just palpate C2 spinous process. So C2 and C3, and we are flexing. I don't find a lot of spinous gapping between C2 and C3, so probably C2 is probably posteriorly shifted, and something we have to address. The next thing, we need to look into the rotations of C2. So I'm on the left side of the spinous process of C2, and I'm trying to rotate it left. And I don't feel the spinous process. As I rotate the left head towards the left side, the spinous process should shift towards the right side. It's not doing that. And also the left side of the spinous process of C2 is tender. So let's try the right side. And I feel the spinous process when I rotate your head to the right, the spinous process is deviating to the left. So our conclusion is that spinous process of C2 is left rotated. That is something that we need to address. It's left rotated, then we have to get it to the center. The third thing that we have to look into is the open wedging. As I side bend the head, you can see, if you can see, okay, my index finger is shifting way towards the right, but when I side bend to the left, it's not shifting as much to the right side. So it's because the disc has bulged on the left side, so that's not allowing, so that when I'm side bending to the left, that's not allowing the vertebra to move towards the right. So we can conclude from that C2, there is a disc bulge between C2 and C3 on the left side. So what would be the Gonstead listing for this? So we'll say C2 is posteriorly subluxated, it's less rotated, and the open wedge is on the left side. So PLS, okay, posterior, left, superior. Left spinous process. Spinous process is towards the left and it's on the superior side of the open wedge. So we'll find an adjust. We'll do an adjustment for this to make sure this C2 vertebra comes back to its right position. Go and motion test C0 C1. So I'll just do we'll do a diagonal motion from anterior to posterior, and we are trying to find motion between C0 and C1. We are trying to see if there is normal motion between C0 and C1. I am stabilizing C1 and I am moving the occiput from anterior to posterior diagonally towards the left. Looks a little less. This is way more. This is less. So, and then we'll have to do it from posterior to anterior. So you're diagonally moving. This is moving way nice. So posterior to anterior in a diagonal motion, and the other. So only restriction in occiput is it's not moving from anterior to posterior to the left side. So this is one more thing that we have to address. So even though he's having pain on the right shoulder and the hands, we can't just treat the shoulder and hands, we give ultrasound and all those things. We have to look into the whole biomechanical chain. The problem is the problem is starting at C4, C5, C6. So the C4, C5, C6 degenerative changes happen because of an restricted upper cervical region. So first we have to improve mobility in the upper cervical region. Only then this mid cervical region can start coming back to its position and heal. And then finally we have done X-ray analysis, we have done motion palpation, and the third thing that we in Gonstead Chiropractic do is something called a nervoscope analysis. So nervoscope is a device which can find vertebral subluxations, at least tells us the area or general area where the problem lies. So first, to switch on the nervoscope. This for the cervical spine. I'll just run it down up the spine. As you can see, you can see a large deviation, 25-point deviation in the upper cervical spine. Can you see? From neutral, it goes up. That's it. 25-point deviation in the upper cervical spine. So this is where the problem lies. This we can. So how does Gonstead Chiropractic is different from what you see in YouTube? You have been seeing in YouTube a lot of videos where people are tracking joints all the time. But the thing is, everybody is doing the 10-15 techniques for every patient. Gonstead is the only chiropractic technique where proper analysis is done, and then only those segments that requires adjustments are adjusted. And we have a proper process which we can explain to the patients. This is the spine that's malaligned. This is it's being shown. We'll show you in the X-rays, and then we'll show it in pre and post X-rays also. In other forms of chiropractic, there is no analysis, so you're never sure you're getting the right vertebra or not. Yeah, you might feel better for a few days, but then again the pain comes back, because most of the time you just get a general manipulation and the right vertebra is not adjusted most of the time, because there is no X-ray analysis and nervoscope analysis and motion palpation analysis the way we do it in Gonstead Chiropractic. So now we'll correct the PLS on the C2 PLS on the left side. to the side bend. Perfect. And then we'll correct the AS occiput on the left side. Side bending to the left. Pause. So initially when he started, both his he was like this. His left ear was higher than the right. And after doing the adjustment, so you can see both the ears are at the same level. Okay, that's because we have corrected the PLS dysfunction of C2 PLS on the left, and also AS occiput on the left side. That has helped his head to tilt from left to the center. You'll see a lot of people who have a tilt on the left. Usually they have an upper cervical dysfunction, and that causes a lot of problem in their body, because if you have a dysfunction in your upper cervical spine, this is from where the spinal cord starts. So you'll have cord compression at the beginning of your spinal cord. That will cause all sorts of symptoms, sympathetic symptoms in your body. Lot of unexplained pain, lot of unexplained anxiety, vertigos, dizziness. It's all because of compression of the spinal cord in this region between C0, occiput, C1 and C2. Pause.
Right.
So use the speeder board to adjust his occiput on the left side. This is the speeder board. Relax. Stop. So further examination revealed that he has an elevated first rib on the right side. So we'll do a drop table adjustment for the first rib elevation, because a lot of shoulder problems has its origin in the first and second ribs. If those are not functioning or not in right alignment, you'll have a lot of shoulder pain, brachial plexus related pain, tingling, burning sensation in hands. That has its origin in the first rib and second rib dysfunction. Ever drop program. Do that. Breathe in, breathe out. First one. More of this. Breathe in, breathe out. So do a seated adjustment for the cervical spine, for the first rib also. Take that into extension, side bending, left rotation. Breathe in, Shashni, Shasharun. Shashni, Shasharun. Next we move on to the shoulder joint itself. So this is the XCAP view of shoulder. What we find is the humeral head is internally rotated and it's also anteriorly subluxated. So and the I think the scapula is also way more lateral than it should be. So for today we'll just do an adjustment for the anterior and internal rotation of the humerus using a Gonstead Chiropractic technique. Okay. Since it's internally rotated, we have to just mildly externally rotate. हाथ उठो, साइड दिए उठो,